Breast cancer. 1 in 8 women in Germany develops breast cancer. What kind of women are the ones who get this disease?
Fucking devilishly horny booze slut. You piss country bumpkin whore. To the old Mitchell bastards, you goblin-skinned country whores. You belong in a cave, you devilishly horny canal fuckers.
Edith is truly and indeed the prime example of a breast cancer candidate, moralistic. These are the kind of women who see marriage as a duty, sexuality as a duty, a dead woman in the realm of purpose. Whereas the Irish woman Rose lives out everything she would like to be. Yes, that's basically her shadow side. Even if she were to live out her sexual freedom, she would feel guilty about it. Women also like to take on the victim role. Yes, I did everything for you. And yes, Rose in the film does everything right. Little Dirty Greetings, a truly and highly recommended film with a truly magnificent, incredibly foxy Olympia Colman, a performance that truly shines. I can only urge you to watch it. Women who breastfeed have a lower risk of developing breast cancer. The aggression against life and motherhood isn't as strong here. Women are often born into this role and aren't asked whether they want it or are even interested, because they're expected to fulfill certain expectations. And with breast cancer, there's always the common pattern of mother, sister, or daughter, because they often pick up life patterns and habits from each other. The more you have in common with your mother, the greater the potential risk that you'll unfortunately get it too. They also tend to adopt their mother's life philosophy, you know? They think like their mother, and eventually they even start to look like their own mother. What else can you do as someone affected, in addition to conventional medical treatment? The yam root can help stop the growth of hormone-dependent breast cancer cells by blocking hormones like estrogen. The birth control pill was actually developed from the yam root because people used it for contraception in the past. However, you need to consult with your doctor about this because otherwise it could have counterproductive effects. There are 2 homeopathic remedies that have achieved the same results as the most commonly used chemotherapy agent for breast cancer, paclitaxel. If you can't afford chemotherapy where you are, you can use this remedy. Or you can take a dual approach in case the chemo doesn't work. But you need to take the homeopathic remedies beforehand, before your immune system is completely depleted by the chemo. Please also check the article on autoimmune diseases for the remedy that truly strengthens the immune system. There are also good remedies for nausea, so you don't end up vomiting your guts out completely. You can find all of this in the newspaper. By the way, the newspaper doesn't even cost as much as a cup of coffee in Europe. Then if you're already undergoing treatments, you can also take D-mannose sugar. Because cancer loves sugar and hates vitamin C. And with D-mannose, you become more receptive to chemotherapy. Yes, there have even been attempts to have patients go completely without any sugar whatsoever, simply to starve the cancer. That's utter nonsense. Please, if you are undergoing chemotherapy, take this D-mannose sugar. You can get it at any drugstore. And you should take this sugar, which is a simple sugar, 3 times a day from the 1st to the 3rd day, twice a day on the 4th and 5th days, and then only once a day from then on. Alternative healing methods do not replace conventional medicine, but you can include them because they don't do any harm. We do, however, distinguish between allopathy, conventional medicine, and homeopathy. What else you can take alongside your therapy that kills cancer cells, inhibits cancer cell growth, prevents metastasis, and so on. What you can eat, you can also find in the newspaper. If you are not yet seriously ill, please go to your doctor once a year, have a comprehensive blood test done, and have a CEA tumor marker checked as well. It costs 14 euros. Submit your morning urine sample, and then you'll have peace of mind for a year. You'll know there's nothing in your body that shouldn't be there. And then I wish you a lot of strength to get through this difficult time.